There we go.
Awesome. Thank you so much. All right, folks. Thank you for taking this time out of your day to be here with us to learn a little bit more about our program and to hear about some aspects that make us an award-winning program. And so to start things off, you'll notice that we talk about it through the lens of establishing an effective program for health and wellness coaching, and particularly putting it within the university context. The way that I like to start when I have these conversations is start very big picture. And so, what I'll be doing is starting with those aspects first with you all, and then getting into some of those weeds as the conversation goes on. I will acknowledge that I've gotten a lot of really phenomenal support and guidance from Coach Michael, Dr. Arlovsky, in this process. And at times, especially given his knowledge of the field and then my experience, because I've been in coaching for over 15 years. I think we'll have a really good opportunity during the Q&A to answer any questions that you may have at your specific institutions or other places of employment that does coaching. All right. So I start by adding this note because when I got to Columbia University, I got here in 2018. And the year prior, in 2017, we actually had a lot of issues on campus in terms with student death and really rethinking this conversation around mental health. And so this statement still stands to be the same. When we look at universities and how we have this increased pressure to develop these innovative solutions to support student needs, it's often only centered on that crisis response piece. And so we know this with a bunch of folks on the call that have been through coaching, that there's no too early opportunity to engage with someone, right? We think of the Travis illness wellness continuum. We think of all of these fundamental aspects that we learn about with mental health promotion, prevention, and early intervention. We want to meet people where they're at, and we don't want them to engage with us once they're already in active distress or crisis. And so knowing that, that's where we really started to put our heads together and think about, well, how can we fill this gap? That's the language we use at our institution to meet this mental health need and also, take off some of the burden from the counseling center. My background is in clinical psych and counseling psychology and student affairs. And so I really love talking across the field of really highlighting that piece that we can work in collaboration. And I'm going to talk about that more shortly. But really, when we think about this sustainability model and coaching, in just a few slides, I'll be highlighting some of the big pieces that really worked for our program. So before I do that, I'm always about giving my flowers. You heard me in the beginning, give a shout out to Coach Michael. I wouldn't be able to have such a phenomenal program if I didn't talk to these phenomenal schools 6 years ago. They were really generous with their time and open to really let me know what's going well at their programs and what's not going so well. Additionally, having the opportunity to do this mini needs assessment of not only what do we need at our campus, but what's going on in the community in the field of higher education / university coaching was really invaluable. And I've noticed over the last 6 years with our program, truly that's been a key cornerstone of helping other institutions start building theirs. It's not only just learning the know-how, but also who's already doing things that works well. Do I have to reinvent the wheel? How can we be collaborative and really build on this together? And particularly, one of the things that I was voluntold was because we were the first Ivy League to have coaching. And I remember having a conversation when I first got to Columbia in 2018 of folks being like, we think this is really great. We know you have this experience. Let's build this out. And so a core component, and this is the slides that I mentioned in terms of getting into these kind of aspects that undergird the work that we do at this more macro or large level, is when we think about JEDI, or Justice, Equity, Diversity, and Inclusion, we can think about how when students move through the campus environment, right? It's the environment, their ability and capacity to navigate health and well-being, the healthcare system. It can all be quite new to folks. We also want to think about these overarching power structures or systems of oppressions when we look at the literature. That's really us relating back to those pieces on the intersectional identity of the individual, the social determinants of health, right? Different things that I know many of you have been trained on in your coaching program. And so when we start looking at health and well-being through that 360 aspect and centering Jedi, we can be really intentional with the type of interventions and work that we do. Hence, the second point, which I would say is arguably the most important, is that for us and what we've seen across the industry, is that health and wellness coaching is a much more viable option for many students. Columbia University is a global institution. And when we think about our students in the different walks of life and communities that they come from, there may be stigmas attached with any type of help seeking. And so, what we really did was listen to the students, looked at the research, and I always make the joke that coaching may be new to other folks, but it's not new to the field. And so I always love doing the road show. And I think that we have a really great audience who knows the benefit and we've seen the research, right? And so when we created this as a tool for folks, really it opened the door for students to want to engage because they're like, oh, well, I don't want to talk to a counselor or a therapist or a shrink. They would use that language. And they pivot to say, I'll talk to a coach. I've had a math coach. I've had a soccer coach, right? And so even the language that we were using, if we think about this Jedi framework, really opened folks to have autonomy to talk about their health and well-being. And Coach Michael, I feel inclined to say too, in the field, I know that you have a counseling background. You were someone that worked in a university healthcare center. So I wanted to pause to see if there's any insights you wanted to share about, your experience there, because you have that invaluable space of being in higher ed.
Yeah, I think that was really helpful. Being in university counseling centers as a psychologist for 17 years, Miami University in Oxford, Ohio, University of Northern Colorado, that really helped me understand the structure of how universities operate. I also taught in counseling education programs there at the master's level. And it really helped me understand some of the challenges that universities face. And today, university counseling centers are just inundated with demand and usually understaffed. And there are, unfortunately, tremendous waiting lists. Now, a lot of the work the university counseling centers do is quite heavy, quite clinical, dealing with all kinds of crisis and trauma and everything else. But, there's also the folks that really don't need a clinical intervention kind of, service. And this is where we're discovering that counseling centers, instead of wondering and being suspicious about those coaches, they're actually welcoming them, saying, oh, wow, if you can take some of the load off our backs, more power to you. That would be tremendous. And I think that's one of the reasons that it's worked that way. So we've been able to reach out to a whole variety of universities and help them develop programs that are unique to their own institutions.
Yes. Thank you. I think that's super helpful to add these differing perspectives as well in terms of how we can think about that collaboration piece, which I'm going to get into in just a moment. But also, Coach Michael highlighted something that I think can be really helpful to think about how we can navigate some of that distrust is when we think about the standardization that's happened over the field, right? And so when we think about, for us, since I am at a university's like healthcare center, right? Student healthcare, we wanted to be within the National Board for Health and Wellness Coaching. And so it was very desirable when I was talking to the other folks about how, yeah, there's this group there, they have an exam, we have all these pieces, and it really got buy-in, which you'll see I have a whole nother slide to highlight that as well. But the standardization and really highlighting in the second bullet of having well-trained coaches who have met the necessary educational standards to effectively and safely support students. For us, it might be patients and clients in other spaces. For these better health outcomes was really the turning point when we showed, kind of the Carfax and we're able to get that buy-in from other folks. And that collaboration has been invaluable. Whereas in some institutions, when they were giving me the context about their schools, it was that they were often seen as in competition rather than in collaboration. And so doing that from the get-go can be one of the most helpful pieces. In the latter half of the presentation, I'll actually show you all kind of our timeline, how we moved through things. But when I did the initial proposal in 2018, I not only did it to Columbia Health like leadership, I went specifically to the counseling and psychological services team and made sure everyone in the room knew the difference and understood what I was proposing. So it wasn't a scope creep, but it was also this opportunity to do exactly what Dr. Arlovsky said in terms of, okay, this person has come in at our intake and they actually don't need therapy. We can have someone else work with them to help move through their concerns. And then Columbia success, right? This is one of the big pieces to top level of thinking about why or how we're different. And it's really the fact that we're a low barrier service. What does that mean? It means that we're open to all students and we're not behind a paywall in the same way as medical services or counseling and psychological services. So the clinical units, they might have student fees or things associated with getting access, but living in the public health or health promotion unit, we're able to open that door and not have that association directly with that department. So students, like I mentioned before, from these differing backgrounds are more inclined to engage with us, but also we serve anyone who is at the Morningside and Manhattanville campus. And that's 17 different schools. The next piece of how we were really successful that really undergirds this is that we did a scaffolded rollout. So it built all on each other. But one of the number one things other institutions had told me was like, don't make the announcement if you don't have enough staff, money, or time. A lot of us in higher ed get told to wear 6 to 7 hats. Even alone as a director, I have 6 different portfolios under me. I have wonderful health promotion specialists that they really lead it. I call them my co-pilots. They're really the bosses and I just help facilitate. But when we think about this stabilization, right, it really ends up being that we want to build this in a way that we don't, one, open up the floodgates and have too much or too many appointments and then replicate the same wait time that we see in our counseling centers. And then conversely, we also want to make sure that we're actually mirroring what the community needs, right? So coaching in different spaces look different in terms of amount of time you do or opportunities amount of time that you can have with a client, how frequent you meet, and so forth, right? And then you'll see here, this last piece is the reason I would argue that we, in concert with these, but most importantly, won the award is because we did it through the lens of the socio-ecological model. And we highlighted, that's what SEM stands for. And so we looked at creating coaching as a multi-tiered initiative that spans the individual, relational, community, and societal level. It gave students more opportunities to engage with us in a way that felt most authentic to them. And so now that you have kind of these big fundamental pieces, I'm going to go into these contexts about at Columbia of why we made the decisions we did, really getting that piece when you registered where it said what works and what doesn't. So we love that Real Balance is great because it works with both of these groups. But when we think about higher education and where you're positioning your coaching program, it's going to make all the difference. Now, at Columbia University, we have an institution that's an affiliate called Teachers College. They have an executive coaching program, a part of their curriculum within one of the schools or one of the departments. And I often have those students come over and do our program because they're like, there's no health and well-being component. And really, I don't think either one is you can't lose with going with either one of these because they're the folks that are really standardizing and working to make sure that we're being ethical in our delivery of care and scope of practice. But for us, being at Columbia Health, at the healthcare center, it all signs pointed to making sure that we are in alignment with the national board. It's how we got buy-in from physicians and from folks. Sometimes we had people often being like, well, what is coaching? And I'm like, are you asking me philosophically or are you asking for like the science? And so that was something that was really important to establish and know the way that we wanted or who we wanted to be with as we were building out the program. Additionally, you'll notice that it's really, really important to have this distinguishable difference between, well, what is coaching and what's counseling, not only within our community and my colleagues, right? And because I'm someone that has that counseling background, I was able to talk about it in a translatable way. You don't need to have that background. As long as you have a very clear concept of what you are calling coaching, and you can have that discernible difference, not only named to your community members, but also the students or patients, that's a big, huge win. Other institutions highlighted to me when I was doing that aspirational institution conversation that basically, if they didn't specify what type of coaching to, you might run into some issues because there might be schools, like I mentioned, there might be the business school doing executive coaching. There may be career coaching going out of one of the student centers. And so for us, we really made sure to let folks know that we're doing health and wellness coaching. And specifically with that, we focus on holistic health and well-being in alignment with academic success because they're students first at this institution. And we explain that they're trained and certified versus the licensed mental health professionals. And I think that language was really helpful for folks 6 years ago when they had no concept of it, because they're like, okay, so you're looking at board certification or a foundational certificate. There's some type of certification with your coaches and with your clinical psychologists, they're going to be licensed professionals. And that's something at that low barrier level of in terms of language can really help faculty and staff better know how to talk about and refer to the difference in the programs. The also really good thing is when you have a collaborative environment, we have referral pathways. So all the time students may show up in coaching, we do our intake and we're like, oh, actually, this is going to be a better fit for you to go to the counseling center and vice versa. The counseling psychologists do that all the time and send them to us. Or we might see folks in concert, which I really enjoy. And so you're going to notice I have a bunch of screen grabs for you of these different articles, publications, things that have come out more media side first, because that was really helpful to have a pulse on what's going on in the field. And so you'll see, like I have some from 2022. The ACHA did a white paper on wellness coaching. The New York Times talked about it. We had it to where Cleveland Clinic. You could see a lot of these big names. And I remember during the pandemic when this Harvard article came out in 2020 and how so many people started messaging me being like, is this what you do at your institution? And I'm like, that's exactly what we're doing. And so when you have this type of information in your back pocket, not only can you send this info to folks to kind of give like, look, this isn't just happening in the academic world and within the coaching space, but this is something that other folks are talking about from these reputable sources. And then additionally, this made all the difference because Dr. Orlowski was really phenomenal in giving me a lot of research because we're an evidence-based institution. So you can tell I'm a millennial because I'm like, show me the Carfax. But that commercial was like, little jingles always in my head. But when we think about not only the proof, right? I have a lot of folks and providers who would say, can you show me these peer-reviewed journal articles? And I love that when this had come out in 2019, I was able to send just like this. They still have it posted. It's a downloadable Excel doc where you can just see article after article that proves how health and wellness coaching has been effective and helpful. And I love the fact that it also includes things that we could work on in the field. And that's what you've seen people committed to. And so kind of having these two aspects of what is the community talking about with these within not only the peer-reviewed academic spaces, but also what is it like in the media? And then a third piece, which I always name to folks, having a pulse on what social media is talking about. This may resonate for some, but I had to do a lot of dispelling of myths around like health coaches and fit tummy tea and selling these things. And it was like the commodification of health and wellness. And so when we have all of those aspects and we're able to come into the conversation and the know on that, that really gave us grounds for people to be like, oh, okay, you're showing me the proof of this practice. You're in the know of what folks are talking about, and you have context about social media and how people are portraying coaching. So this one, I even put the font in a different color just to draw attention. And when I go about, I've done 6 different national/international conferences talking about coaching. I tried to put it off for as long as I can. And they were like, you got to get out here and tell people about your program. And so when we hit that 5-year mark of having really great success and rapid growth, I think this was one of the key pieces for us. since Real Balance owns the curriculum and maintains it, it's been invaluable to us as an institution, because then I'm not wearing that hat of needing to make sure that I'm updating my own training materials to be in alignment with the national board. I really was looking for collaboration, because at the time of the launch of this program, this is when I was a team of one. I was a team of one for 4.5 years. And I was a health promotion specialist, and I had been brought in and told, here's another thing. What is it? Other duties as assigned. And I was like, okay, we're going to do it. But with that, when I found out that I didn't have to like build this curriculum, have it be a Columbia University is extremely expensive. It's an Ivy League. There was so many different pathways that people were doing units for it. They were talking about these different enrollment programs. I looked for what was the most affordable, as well as what program can I collaborate that will really give me guidance. And I have experience both with Real Balance and Well Coaches, but I ended up going with Real Balance because not only maintaining this curriculum, but the guidance that not only Coach Michael, but also Deborah provided in these moments when I was like, what do you think I should do if this is my budget and this is my population? And it was really helpful for me in solidifying as I did that slow burn of building out the components. It started with just me as a coach, and then I got a part-time coach. Then I moved to having peer health coaches. You'll see more on this later. But given that they also are an approved program with the national board, it just made so much sense. A lot of programs that I've talked with that have even I might have talked with initially, and then they gave me insight after the pandemic. They came back and were like, how did you sustain it? How are you able to still survive the pandemic and be able to have a thriving program? And one of them was that I wasn't worried about maintaining this curriculum and or aspects of what the national board requires you to train folks on. I was just simply trained by Real Balance to be a licensed trainer for my institution. So I can't stress this part enough of that's where this really good partnership came in and how I've been able to sustain the program. Now it's great. I have multiple folks. I have a health promotion specialist of wellness coaching who helps me run the programs, and I even have a donor funded role. And so for any of folks listening on the call, if you're ever worried about the money aspect and you're in a higher education institution, even if you're not at a 4-year, I've worked with 2 years, international institutions, feel free to always reach out to Deborah at Real Balance or myself. More than happy to help you think about how you can kind of move through that piece. Awesome. Anything you want to add, Dr. Arlowski?
Oh, just that I was actually one of the founders of the National Board for Health and Wellness Coaching, and spent many years helping to develop that. And just want to add part of the validity of the National Board is that the national exam that you mentioned is actually provided by the Medical Board of Examiners, the AMA's Medical Board of Examiners. So it's quite robust, as you might.
I'm not sure if he froze or I froze.
We have a freeze thing going on. Okay, I think we're still whirling now.
Okay. Yeah, you
yeah.
froze. I don't know which one of us froze for a second, but
Okay. Yeah, I was just saying that the National Board for Medical Examiners of the AMA actually provides the exam for the health and wellness coaches through the National Board for Health and Wellness Coaching. And now I'm happy to be a board member emeritus of that organization. So I'm still very much in touch with it and everything. So we really stay on top of all the requirements for approval. And like you said, it really works really well for us to provide the updates, the continued training component, and not have to have that be a burden to you.
thank you.
Mm-hmm.
And so as we kind of roll forward, this was something that was really helpful. So when we were building it out, I was tasked, like I mentioned, that little needs assessment. So I was looking at the community, and there were several points, right? Not only was this an iterative process, meaning we cycled through it multiple times, but we looked for direct feedback about what do you think about coaching, to students in particular, how they see it might be beneficial. We talked to campus partners about how they could see it as an opportunity who need to refer folks to us. That's advising deans, that's program coordinators, it could be residence hall staff, you name it. Point of service evaluation, meaning after they've engaged with Columbia Health and had an appointment with us, we do those surveys to ask them about the care we gave or the delivery of care. And then these other two with the ACHA and well-being survey, those are two instruments or surveys that we were able to look at trends and really get great information about what students were looking for. For example, we're able to do coaching around relational well-being and look at loneliness and connection and think about how we can move through that space and spend more time building that community aspect, right? I know that's something that shows up often on these type of assessments, as well as just wanting to be connected at large. And so this was the timeline that I had mentioned for folks. When you look at this, you could see I highlighted that we had a multi-phase, multi-tiered initiative proposal that happened. So it went needs assessment, talking to all the campus partners, constituents, going to counseling and psychological services, and then really making the big proposal and solidifying it with my boss's boss to make sure that it was a sound plan, you know, to kick things off. We set the schedule to be over the course of 5 years. And so we've successfully had a little bit of a not lull, but a little bit of a delay with the pandemic, but also the pandemic kind of catapulted us in different ways, which I'll talk about soon. But you'll see we did the proposal, started coaching, and that's where I was seeing folks initially. When I was the only coach, it was by referral. So it had to be that it went through medical services or the counseling team first. They then decided, oh, actually, we have a better resource for you. And then they came to me. So that's before we had the page on the website and all that stuff, right? Because going back to that slow burn, I was one person and there's 35,000 students. We wanted to make sure that we didn't have that piece to where we open this really cool initiative and then the students are like, yeah, I can't even get an appointment. We want to make sure we're being mindful of the feedback they gave us. Then we launched our peer coaching program. It's called the Wellbeing Advocate Program. And then after we had that initial launch, we moved into training staff and faculty to serve as coaches or to be more coach-like in their practice, to make seamless referrals and show up in a dynamic way. And then we've done a few pilots, and that's one thing I should name, with the group coaching. I was doing pilots over the last couple of years, and we're finally at a place to where we're going to put the website up, and come fall, it'll be registerable for like anyone in the community to come to a variety of different group coaching spaces that we are going to offer. And so you can see that over the course of this time, not only was I able to do that iterative process of getting feedback, but also incorporating the aspects of what I've learned, because perfect example is when I started doing this in 2019 or 2018-19 school year, we didn't have Zoom as an option for delivery of care. As soon as we went through the core aspect of the pandemic, right, when everybody was at home, we had to build out that opportunity. And now we see that our students, they prefer to come to us to wellness coaching through a virtual modality. We have a few here and there, but I think it's like 97% want to come virtually as opposed to in person. And then some folks often ask us, well, how did you find success with these coaches? And this is what I named. We have that multi-tiered approach, but also different levels. So we have it to where our well-being advocates are the peers, and they go through the CWHC training, and they sit with us for a year in their appointment. And after that year of volunteering, that's a requirement, they can return with us. It is, we only have it as graduate students who are the well-being advocates. The rationale being, only a third of our student population, 10,000 students, are undergrads. Everyone else at Columbia are graduate or professional students. So it made the most sense in terms of being able to resonate with the individual in front of you. A lot of schools will often only have the peer component, or they'll only have the professional staff. What we've done here with our CWHC is we've trained everyone across our health promotion public health team, right? So anyone who is within the department that I work at has been trained in, or is going to be trained. We have a couple folks this summer, our last ones, they're the newest folks that have joined, but Those folks get the foundational CWHC to be able to help coach, and then they're on that national board path if they choose to move forward. A lot of them have CHES and other certifications as well, but majority of the coaching is done by our lead and folks who have the national board certification. And this really helps too, not only with varying levels. We have it to where students are like, I only want to talk to a national board person. And we're like, great, we'll get you set up. What's pretty unique about our institution, and I'm sure you all have seen us in the media over the last 6 months, we are the activist Ivy. So our students are very into student expression and talking and being in community with each other. It was a fundamental part that we have a peer program aspect because the students said that they often feel safer talking with our coaches who are peers. And because it's under that lens of confidentiality, it made all the difference. So you would think sometimes people are like, who would want to talk to folks that are, maybe that don't have the most experience or training? Our students love the peer-to-peer model. We do it with our substance use recovery work. We do it with our health education stuff. We really try to create that space because it's what works at our institution. This part is interesting too, right? Some of you might be like, ooh, that's a lot of time. Whereas other you are like, finally, it's enough time and space. We recognize that with our foundation session, we were trying to do different increments of 60 minutes, 30 minutes. Students had shared with us across all of our departments at the university that they felt like health services was treating them like transactions. And so when students tell us, and we can see that, they're like, I get into this appointment, they barely talk to me. And this is across different spaces, right? The wait time with counseling, with medical services, the quickness. And then when they come to us, we previously, prior to this program, only had specialized appointments around sexual reproductive health or substance use and recovery. So this is the first time that people are really able to come to us and have an initial conversation, diving into all their health and well-being and giving a space to come back multiple times to keep working on things. We do have programs around health education that are one-offs, but students really explain to us that they love the opportunity, and we use the language of up to 90 minutes because it doesn't mean you have to. Sometimes you get someone that it's culturally not one of those big pieces. They're still trying to assess and see if you're safe. And so they may only want to meet 30 minutes for their foundation session or 60 minutes. We don't make them, right? We don't force them to be there the whole duration, but we give them that flexibility so it's up to that 90 minutes. And then of course with follow-ups, it's up to 60 minutes. We don't have a session cap, and the frequency really is on a tapered schedule. We did some initial assessment in the first couple years, and it's shown to be the same each year after. Students tend to meet with us. It'll go week 1, foundation. Next session may be the next week if they felt like they couldn't capture everything. But then after session 3 or 4, they move to at least every other week or once a month. So when you look at us being in the semester schedule, we go from September to May. We have most of the time about 10 to 15 appointments that happen with one individual person. So that's not too bad when you think about how we're spreading the wealth in terms of having peer coaches, CWHC, and national board coaches. And I should really just say, when I did my fingers, all of the peer coaches have CWHC. So you're either national board or CWHC coach. And the too long didn't read of all of this is that we make it super accessible, low barrier. They can do the intake form on the Columbia Health website. They don't have to call. Really with the, when we think about the different populations, our students span Gen Z, Millennial, and Gen X. We have a few baby boomers when we look at age demographics, but for the most part, when we think about our degree-seeking population, we're trying to also be mindful of what differences might exist there. And so I make this as an anecdotal note. We make space for the millennials to call to say, I'm not going to be able to make my appointment. And they also send the email. And then we have it to where Gen Z can send, it looks like a text message in my inbox. Can't make it, I'll reschedule. So there's different communication styles, there's different pieces. But what we know is that we center all of those narratives in this process so that when they want this one-to-one coaching, it's an option for them. And we let them know too that if they want to take a break in return, they always can. They're with the same coach the whole duration of their segment. If they take a break, they might end up being paired with another coach because they do take a new, they do a new intake form because we want to have that wellness wheel and the scope of what we're doing, and they have to give consent and all of that jazz. Also, I'm foreshadowing, but all the conferences that I've been going to, I created a Dropbox with all these materials. And so I'm always just like, here, have it for free 99. So at the end, I have a QR code that has all of this stuff with our different pages and everything linked. So I'm gonna take a drink of water. Once again, Dr. Arlossi, anything you want to add before I get into the nuts and bolts of our program, what it means to be the multi-tiered initiative?
I'm just remarking at how much information you are conveying in just this 1 hour here, and really only in the first half hour of it. And I really I'm hoping that um, people are going to be taking advantage of the information you've got, the handouts that you're talking about there. And just also want to say that we're also going to be showing you a slide giving you contact information for how you can reach out to Real Balance and get even more information. Find the page on our website that describes what we do for educational institutions. So all that'll be coming your way.
Awesome.
Hmm.
So in this last segment, this is really where I'm going to highlight these last fundamental pieces. There's a lot on these slides. I actually give an even more. We did a 3-hour pre-con at ACHA, and that one has like 70 slides. That's going to be in the folder as well. So it gives you even more information about all of this. So the multi-tiered initiative piece is what makes this so innovative and sustainable, right? I've been kind of giving you the macro pieces and all the other fundamental pieces that build it up to this aspect. And so when we look at it, we're housed within this department of Alice Health Promotion, which is like our public health office. And that's within the Division of Columbia Health at Columbia University. That alone creates opportunity for students to want to engage. Some folks have their coaching programs in the student affairs unit, and it may mean that there's a duty to report. Students may be less likely to really be authentic and share all aspects of themselves if they can't, or if they're not promised confidentiality, right? There's some aspects to that. Because we've then mapped it onto that socio-ecological model, that creates that engagement piece. And then, of course, for institutions, they're always talking about how does this relate to the mission, vision, values of your institution? And so we really to make sure that we're in alignment in that aspect as well. And so when you see here, kind of answering the how we do this, it's at the individual level, it's that one-to-one piece, right? And so it's the overall health and wellness aspects related to attitude, skills, behaviors, knowledge. Then when you think about relational, we built out that component of the well-being advocate because it has that shared common identity of being students within the same social network as well as the same like lived experiences. When it comes to community, we've created community-oriented spaces through group coaching. And then societal, we do that in the context of the university. So staff and faculty alike are trained to not only be non-judgmental and supportive, but to know how to center students' health and well-being and appropriately refer to our program. And so a lot of people ask me, well, how do you know you're successful? And they really make us assess everything at Columbia. It's one of those things that I always laugh about where we have to do it all the time. So not only do we look at the growth in utilization, and I'll show some of that, the numbers look made up. I always have people giggle and they're like, oh, our students evaluations, right? We call that point of service evaluation, letting us know about how they're experiencing us. So even in these first two aspects, it's qualitative and quantitative. Feedback from staff about not only attending the trainings, but like, how is the process of referring to us? And then additionally, what's their perception on coaching? We want to know what we're up against in terms of how we can better communicate. Can we make our materials more health literate? Is there ways to be more dynamic in the way that we're building out this program? Of course, we then, this is really a shout out to our manager of operations, Nikki. She was the one that was like, you should start documenting how many people are talking to you. And I did that all the way up through this end of the year, and now I've stopped, and you'll see why. But being able to document how many engagement points we're having and how people see value in our program really does matter. And then we always have an annual evaluation to ensure that our initiative is actually doing what it says it does, right? Like, is it actually meeting those aspects? And so this is the part that I was jokingly saying how we have some numbers here, because you can see the real big jump here when we added the peer coaching program and we had more folks to be able to help coach. once we had a lot of these other pieces, with this slow burn built out, you can see that we had that huge increase. And when you look at that 343% increase with our students from 2022 to 2023, you compare it to our inaugural year where it was one coach versus now we have 25, right? And so when you highlight those type of aspects, that's why I tell people, I'm like, the numbers look kind of fake, but they're real because we just have way more people and way more bandwidth. Additionally, one thing that is like very scary, if anyone's in higher ed, you all know this, the student press can either love you, hate you. Sometimes it can go anyway, sometimes it's a mix. But we got really good feedback from not only Columbia News, which is the university press, but also the Spectator, which is the student paper. So that was actually really cool because we didn't even know that it was going to come out until they're like, would you like to comment on this? And we're like, oh, okay, sick. And then the last one, I was charting it through the different, this year alone, right? I was keeping numbers. And so as of December, we had 41 schools. Then when we got to January, we got up to 75. And then through ACHA, we've now had a touch point of over 100 different institutions across the US / some international who have either asked for guidance, mirrored our program, adopted it, or I'm working with them currently so they can build something out / I want to also give kudos. I've been redirecting some of them because I'm like, ooh, that's a Deborah question. You got to ask Deborah and Coach Michael. But you can see it's very successful in regards to that component. And then I wouldn't be me if I didn't give you the feels and highlight the really awesome aspects here of that we got this feedback from students, and I highlighted and bolded it so you can see, right? Like this one has been phenomenal in terms of the conversations we've been having because universities are going in the right direction offering a service like this. You can see too about how this person talks about how transformative it was for them. I know I'm preaching to the choir here in terms of most of you are probably coaches or coaches in training, and so you know the value of having this as an opportunity, but really talking about the long haul, thinking about how these different positive changes help overall health and well-being, being able to break things down to be manageable and accomplishable steps, and then the huge piece of it being a safe and comfortable environment. And so I'm going to wrap up in just a minute so we have time for questions. And I'm full screen right now, so I saw some notifications I'm sure people have been asking. But I wanted to give the context here. This is a QR code that you all can scan on your phone. If you don't have a smartphone, I'm going to drop the different links. We have a bit.ly link that just shortens it. And then we also I'm going to give the direct link to the Dropbox. You're going to notice it says ACHA because that was the biggest conference I went to. But it has all the materials of not only foundation session guidelines, what our website looks like, the information about us being award winning, like our training program timeline for our well-being advocates. It has all that info to kind of be a hub of kind of the things that I wish I had access to when I was building this program 6 years ago. And so, and it's always being updated. So wanted to offer that to you all and give an opportunity to take that down now. I'm going to do about 10 more seconds. And then, like I said, I'll drop the links in the chat when I stop sharing. Okay, I'm going to go ahead and pivot to stop sharing and drop it.
Well, incredible presentation, and just so happy that you're sharing this with so many people. You're being so generous with all that you've learned, and I really want to again congratulate you and everybody involved there at Columbia in receiving those awards. I mean, it's wonderful when you get that recognition, and when people realize that you're doing something of real value, with your students. I'm going to go ahead and share my slides a little bit here just to give everybody some heads up here. First of all, we do have one or two questions here in the Q&A. And on Zoom webinars, rather than meetings, Q&A works better than chat. So go ahead and use the Q&A function. Go ahead and start putting those questions in there. And Jackie and I will start fielding those. Also, here's the information about how you can contact Real Balance. You can go to our website, and we have a page there that you can get to by just doing our URL and then /educational-institutions. And you'll find a whole page with information. email Deborah@realbalance.com. There's the phone number to call. We're very happy to take your calls and connect with you. And we are really good on following up with that. So please, follow up with that and stay in touch with us. Let me just go ahead and stop the share right now and get after these Q&As. So, got a question here from Audrey Boyce. She's talking about the stress that nursing students experience, congratulating us on the program here and so forth. She says, I'm on the board of visitor at a local college nursing department. I've been providing 2-hour workshops and wellness talks to faculty and students. These activities have been helpful in the survey and testimonies I'll receive in regard to self-care and stress management. My question is this something that I can propose to a department, as so many of the nursing students and faculty are reporting high levels of stress?
Yes.
Certainly would be.
Yeah, I think it's, hopefully I'm saying Audrey right. I would say, yeah, we at ACHA, I actually had a bunch of different nurses that came to my session that particularly were talking about how can we help bridge that, fill that gap of, we have these inundated populations, whether it's nurses, clinicians, like counselors. I think it'd be a really great tool to put out there. We've even seen some programs where they wear multiple hats. They're like nurses who get this training and they get hired specifically to help take those type of situations on. Dr. Arlovsky, I didn't know if you had stuff too.
Yeah, we've trained many nurses, and anyone in the whole medical field is experiencing very high levels of stress, to say the least. So it would be, I think, very valuable, to folks like that. Linda's asking, and she's in Lincoln, Nebraska. Have you connected with the University of Nebraska? No, but we'd be happy to.
Yeah. And with my list, I'd have to look. I know that I've talked to people in Nebraska because I remember talking about the weather, but I would have to double check on that list. But Linda, I'm sure you can always feel free to refer folks to either Coach Michael or myself.
And some thank yous from different people. Also, Renee saying, this is so incredible. Thank you so much for all your insights, experience, materials, etc. Exactly what will work in higher education and meet meet a multitude of needs. That's what I think, we've really been trying to provide here. Angie is saying, can you talk more about the well-being advocates? How are they trained? Does anyone take the training for college credit?
Yeah.
That's a question.
Yeah, so I'll answer the second one first. Because we're at an Ivy League, I come from a low-income first-gen background. And so when I saw how much it would cost, it didn't make sense to have them take it for credits because there would be no way to waive that when it's a part of their programs. And so it's one of the reasons I waived it out, because it's even one of the reasons I went with Real Balance. Real Balance is so affordable compared to other training programs that are often like, their sticker price for the first class is $15,000 if you do it attached to an institution or organization. And so we did not do that component in terms of giving college credit. Instead, what we do is it's on our website, Angie. If you go to our page, it talks about well-being advocates, and we have a link there that gives all the details. But what we do is we do a cyclical recruitment process and training process. Every January, we start preparing. Come February, we put materials out. March, we interview. April, we offer. June, they do all the pre-work. July, we do an intensive training with the CWHC curriculum. All of August, they get trained on Columbia Health, and they start coaching in September, and they sign an agreement with us to be in the position for 1 year. All of the materials for that, Angie, is in that Dropbox. So you'll not only be able to see a visual aid that shows you the timeline of when we do it, it also shows you the description of and links, because we keep the well-being advocate recruitment page up all year round. We just indicate if it's closed or open at the top. Get involved. It's on the Get Involved page. So I know I rushed through that, but it's all there. And if you need support finding it, I'm more than happy to send it to you. I also want to make a sidebar I saw someone had wrote that they didn't get my chat. So if you look I put it as an answered. So someone wrote, it seems like the chat is disabled. Is there another way to access the info? Hopefully you all should be able to see. Yeah, it's in
Yeah.
the answer Q&A. There's a link
Yep.
there.
On Zoom webinars, chat doesn't work. So all Q&A. And like she said, if you look at the top of the Q&A, you'll see open, answered, and dismissed. Check out the answered part, and you'll see the information there. Also, just want to add that some universities we work with, students do get credit for the class that they take. Some of these institutions, what we've done is we've trained faculty members to be licensed trainers, just like Jackie has become. And they actually offer semester-long or quarter-long, whatever, courses to the students that become either peer, coaches or become coaches in their program. So different universities do it different ways, but there are a lot of different options. And when you don't have the Ivy League prices, and the students are already enrolled and so forth, they may be able to take it just as part of their regular college experience. So let's see, we've got one here from Megan Merchant saying, do you see particular sites where university coach job positions are being posted? I was a health educator 10 years at a university and would have loved working directly with students in addition to group curriculum, but would love to work in a successful coaching program before launching in my state.
Yeah. Yeah, there's a few. So if you, Megan, if you look at ACHA's job board, so the American College Health Association job board, they have positions. If you are a national board certified coach, they actually have a Facebook group and they have a job board that posts those. And then the last place that's a little bit more, it's not as frequent, but higher ed jobs will sometimes have them posted there. And so the four being national board resources, they always have things posted if you do have your boards. Otherwise, ACHA, so the American College Health Association job board, or higher ed jobs. Those are the three that I often will send folks to. I'm not a big LinkedIn user, but I know other folks do that within their network as well. So if you're connected to other coaches, they'll post about looking for a coach with the parameters.
Mm-hmm.
Oh, and I actually have another point, Dr. Arlovsky.
Yeah,
You'll see this too, Megan, that they're starting to now ask for you to be a certain level of ICF. There's the three different levels with ICF, or they'll ask for you to be national board to apply for the positions. So that's something I just want to name because it's been with this regulation of the field and more legitimacy showing all of this. They want folks that have that background, especially if someone is in an office or in a department or a student health center that codes, because there's now codes to be able to, charge for delivery of care around coaching. We don't do that. We're low barrier. You just have to have you need to have access to us. But I have seen other schools have like a nurse who is also a coach. And so when they meet with the student, they code it in that way.
Yeah, and institutions are looking for that certification because it's kind of automatic vetting for them. When you take a look at coaching versus therapy, the reality is that coaching is not providing treatment. Therefore, it is not a licensed profession. Treatment professionals have to be licensed, and licensure is state by state. It's all kind of regulations because we're not providing treatment. We're not, in that situation. So anybody can call themselves a coach. You could be a used car coach, anything. But a certified health and wellness coach, that gives you legitimacy. An ACC, Associate Certified Coach with the ICF, gives you legitimacy. And that distinguishes you from all the wannabes out there where, an institution really doesn't want to look at those folks. They want to look at people that have really good, solid training. Mm-hmm. Let's see. Okay, so Wendy Lois is asking, can you provide details about the peer training? Grad students took a CWHC training and did they become board certified as well?
So great question. So the way that we set it up, because they stay on with us, they have active supervision. That's a requirement of meeting with us. Some do, some don't. some people, and I really actually recommend this to everyone. That's why I love the way that Dr. Orlowski's program with Real Balance is scaffolded. We've had students that go through CWHC and then are like, ooh, I don't think coaching's for me. And then they do the volunteer program with us, having that CWHC while they're collecting that experience. Some of them go on to do the other components of the master full course and all of the basically the requirements to become board certified. So what we have is that really theory to practice translation is huge, and our students have loved it because we go through and have them get all the necessary training in the summer, and then they spend about 2 months doing buddy coaching, case study, really getting connected with each other to make sure they feel comfortable coaching. Then they go out into the population to coach. And during that time, they're getting their CWHC, they're being supervised. And those are the folks that come by January, if they want to keep moving forward, like this last cohort, we had 3 people who went on to do all of the other components and are sitting for the boards this summer. So it depends on the individual, but we've said it because of the peer component. Those folks have to at least be CWHC and have a foundational level or certification of coaching. I hope that answered, Wendy. Feel free to add another note if you were looking for more info.
Well, I think our last Q&A here really kind of says it all. Lori Ann says, that was an awesome presentation. Jackie is doing amazing work. Thank you so much for this presentation and resources. Well, I especially want to thank you. You just knocked it out of the park, I'm telling you, with your presentation here. Just wonderful stuff. And thanks again for doing that. And I just want to share that we're going to be taking the summer off a little bit here, doing our next free monthly webinar in September. We're always doing the last Friday of the month when we get these rolling again. So stay informed by checking out our newsletter and that kind of thing as well. So I really want to thank Jackie once again for this incredible presentation. I'm going to go ahead and